Good evening. It is now 5 p.m. Welcome to the November 17th, 2025 Public Safety Committee meeting. I am Rob Watton, Chair, and tonight's meeting is being recorded and available on the city's website. Thank you for joining us. Now we'll move on to the roll call and let the record show that all council members in this committee are present. Councilmember Christensen, Councilmember Cotton, and myself, as well as City Attorney Burke, City Clerk Dean, and Legal Assistant slash Deputy City Clerk Robert Thrall. And with that, I need an approval for tonight's agenda. Is there anything that you'd like to change or alter? Do I have a motion to approve?
So moved. Second.
Moved by Councilmember Cotton, second by Councilmember Christensen. Any further discussion? Hearing none, we'll adopt the agenda as presented. Next, we have public comments. We are allowing public comments in person. I do not see any members of the public present unless anybody else here has something to raise. And seeing none, I will close public comment. Just as a note going forward, if you are watching and you want to send your concerns or other comments in, please do so to City Clerk Dean or myself or members of the committee. We always welcome that. And then the very next thing is that we need to approve the minutes dated November 3rd, 2025. Do I have a motion?
So moved. Second.
Moved by Councilmember Cotton, second by Councilmember Christensen. Any corrections, additions to the minutes? Seeing none, we will accept the minutes as presented. And next we move on to the agenda bills. AB 25-120, electric motorcycle ordinance. Chief Harese, you are up. Good evening.
Good evening, council members. I'm going to share my screen even though you have it in front of you. Maybe let's do this.
Councilmember Dean, may I close the door? Okay, thank you. It's just, I'm hearing footsteps. Makes me nervous. Thank you, Chief.
Okay, so as you are aware, we've been discussing the e-motorcycle ordinance for quite some time. We had a big discussion at the council meeting a couple weeks ago where some revisions were asked to be added into the ordinance that we had proposed. Mostly the change was made in the section of the fines and then separating the parent or guardian responsibility in here. So other than that, I don't think anything is really different, but it leaves the fines with a tiered fine system here of 250 for first offense, 500 for the second offense, and the third and subsequent offense is 750. Under section 1036.030, we added the parent or guardian responsibility, basically stating that no parent or no person shall cause or knowingly permit his or her child or ward under the age of 18 to operate one of these devices, and also tiered out that offense section. And it got rid, we would still forward cases up to the prosecutor's office for review because they're the ones that implement, that send the or issue whatever that penalty is, and based on those fines. So like, if you don't know if y'all have any additional questions on this. I mean, I know we've kind of discussed it a lot in this committee, over the last year and a half, and I've presented multiple times on this ordinance with discussion pieces.
Councilmember Cotton.
I just had one follow-up, and maybe I was misinterpreting it, but somewhere in here, I recall reading that I know they have to be 18 or over, but wasn't there something about being over 16? As being able to operate as well?
So you have to operate it, or if you want to operate it, you have to be 16 years of age, have a driver's license, a motorcycle endorsement, and the motorcycle has to be street legal
Is,
per the RCW.
is that something that both the license and the motorcycle endorsement that some juvenile of 16 or older can get? So I was wondering about that 16 to 18.
They can get it. So if they have a license, I mean, what we're saying here is if you're under 18, the parents can't, knowingly let you do it.
Mhm.
And operate them in any manner that would be deemed reckless or cause problems. And it's the recklessness that we have the biggest issue with.
Mhm.
But you can obtain a license when you're 16. The odds of you getting a motorcycle endorsements, it takes a lot more because you have to go through your probationary period. The odds are you're going to get it closer to the age of 17.
Okay.
By the time you get done with your probationary period, maybe even a little bit longer. That's a DOL thing as far as when those are issued, and not something I really get into.
Mhm.
We will see what is prohibited under the endorsement when we run somebody.
Mhm.
So if you have, we'll see the endorsement for motorcycle your motorcycle endorsement. But if you're, let's just say you're driving a car, you're 16 years old, and it says you can't have anybody other than your sibling in the vehicle, we will see those stipulations when we run them. So we'll see all of that ahead of time.
And with our ordinance, they can't have a passenger.
Right.
So, yeah, that's why I was wondering, is like, because I always think of being like a new driver where you had to have somebody with you for a certain period of time.
Right. And that's one of the reasons you're not going to see them having a probationary license and a motorcycle endorsement at the same time, typically speaking.
Okay, that makes sense. Thank you.
Excellent. I've got 3 questions.
Okay.
First of all, what's the difference between electric motorcycle and something like a Vespa?
CCs on the engine, the way there's not really a lot,
Okay.
but there is in definition when you look at the RCW.
Okay.
So like mopeds and
Mhm.
things like that they're going to have a regulated CC or, cubic inch per engine or for the engine size, where these are going to be wattage and go, 60 miles an hour. You're not going to see a Vespa hitting higher speeds like that.
Is there a possibility that there could be a gap
No,
between a
because
Vespa?
we're defining these as electric vehicles. And when you look, the RCW is very clear on what a moped is and what a Vespa is, those devices.
Okay.
They're very, very clear on what those are. So there's 2 different definitions, and we're specifically addressing electric motorcycles.
And the other question, is there any possibility that you can't impound or that we get into some legal gray area if it doesn't have like a VIN or something on it? Maybe it's a home built one.
I haven't
Is there,
seen any home built ones yet.
it concerns me because so many of these come from, like for instance, China, and they're not always, are they always properly labeled?
Unless the VIN is removed from it, they should be properly labeled when they're shipped.
Okay.
And even if it's not properly labeled, if we can prove what it is and what the engine size is, and the guys are still going to be directed to Google the exact, the exact model, make and model of what it is, simply because they don't sit there and list like what the wattage is on it or how big it is. So we actually have to do a little bit of legwork on it, and we can still impound it. We also still have discretion. So if an officer feels that they want to, that parents are cooperating or whatever, or the device may not be in the criteria that is set in this, we can release it back to the parents and just have the parents come pick it up. So there's always going to have officer discretion in there.
City Attorney
Yeah.
Burke.
Yeah, thank you, Councilmember Watton. One other thing about the kind of the homebrew e-motorcycle is they do have to be registered with the Department of Licensing and have a license plate. So there's that whole process that they would have to go through for whatever contraption that they're riding on.
So it's still possible to impound not a street legal device using our public streets.
If they're violating something, yeah, then it would
Okay.
still be possible.
Okay.
And if somebody's let's say they're operating it, they're 14 years old, they don't have a driver's license, they don't have a motorcycle endorsement in any way, if we can prove that it's over the 750 watts, we will impound it, because that gives us the violation alone of the endorsement allows us to impound.
All right, good. Any other questions?
Thank you, Chief and City Attorney, for, I know all the work you've done on this and appreciate it because it's really come together.
Yeah.
Thank you.
It's a
Thank
huge
you.
resident concern and appreciate you guys taking action. So thank you.
Well, I just hope
Well
it goes
done.
through in the next couple of meetings.
Thank you. All right. The next item that we have, unless there's anything else on the agenda, I did not
So is
print.
this going
Hmm?
back to council for the
Yeah,
vote?
yeah.
Is it needing
Would-
more public hearing or
First
needs
reading
to-
of the ordinance,
just the reading? Okay.
reading, yeah.
Yeah, first reading will be at next week's council meeting, and then the second reading and voting to whether or not to adopt would be at the December 8th council meeting.
Okay, excellent. Any other concerns?
Hmm.
All right, we'll put it on the agenda for the next council meeting. Discussion, Crisis Care Center update, and I believe Council Member Cotton is going to take the lead on her notes. We're at 5:12, so we should have enough time to go through a discussion as well. So I'll let you lead off.
Thank you.
Thank you.
So this afternoon, I was on a Zoom meeting with that was provided by SCA and DOH, the Department of Community Health Services. And they basically were providing information to surrounding jurisdictions about crisis care centers and relating to the levy that was passed. So this levy is for 2024 to 2030. And the goal or the passage of that levy was to provide 5 crisis care centers. So one has already been done. That's the one in Kirkland that was put forth by Connection Health Solutions. And so that was the first procurement in 24, and they actually got up and running sooner than expected. So since they were up and running in 25, because they weren't expected to open till 26. So we're into round 2 now in the application process. And basically a little background on the critical care centers with that is that since the first was in Kirkland, the 5 total will be open by 2030. King County, they are procuring the CCC operators, but will not be running them. They will assist in many ways, but they will, and of course, will be, inspecting things. But they are looking at putting 4 more of the behavioral health injuries centers in to the zones they have set up are north, which is the Kirkland one, central and south zones. And then there will also be a east zone, which Snoqualmie's in the east zone area, and there will also be a youth facility as well. So the youth facility can be actually in any zone, so it's not required to be in any certain zone. So that one was interesting. But the background of the crisis care centers is that they provide immediate care with for mental health acute issues, drug or alcohol challenges, and you don't need insurance. They're available 24/7. They're kind of a tiered model on this. It's 80% they find of the behavioral health services can be provided on an outpatient basis. And then the next tier is in that remaining 20% that might require additional help. And so they will provide a 23-hour and 59-minute observation with for increased acuity care, and that will have a designated care provider. They can provide meds, and it's tailored to the individual's care. They also, the third tier in these facilities, that they will have a crisis stabilization unit where a patient potentially has more time for the meds and treatment, and again, individual care or group sessions or whatever they might need for up to 14 days. Eventually, all roads lead to discharge and other resources. So, and the post-care can be up to 90 days that will be provided with them. So, of course, the goal, which we've talked about before, is to decrease the reliance on the emergency rooms, hospitals, and jails, where it's basically tying up the resources and the staff, because, and many times the staff they have to sit with patients for hours since they're not, they don't have the adequate facilities, obviously, to do that. ERs, we don't want to be the primary destination for first responders to go there with mental health or behavioral health issues. So this expands on King County's behavioral health continuum of care. It's estimated for each one of these facilities that they will employ 120 to 140 full-time staffers. And so that definitely can have an impact in a jurisdiction as far as, perhaps being able to employ folks and, provide the services. What they would ideally have: peer specialists, certified peer specialists, mental health techs, nurses, psychiatric providers, the mental health providers, substance use providers. So they will have all of that under one roof, so to speak. And then as I mentioned before, that King County will procure the operators for these facilities. And then there's also some incentives for the local jurisdictions in that King County will help provide support, not only some staff assistance, but there's also some the financial help that they can provide with that, as they realize the local jurisdictions have to work with, zoning permits and licensing and things like that. So they definitely, it seems like a pretty extensive operation. And then the RFPs, the second phase is what's out, the second level of procurement right now is out for bid. And so they just put that out. So they're expecting that in April and May, they will then be having those evaluated as far as for this second round. And the second round is going to include two response zones, which is going to be the youth and east crisis centers. Now, there's already kind of in the works, but they haven't made any announcements because it's under review right now for the other three. The Central and South, they've already ID'd some operators. Not three, it was two. Central and South, they've already ID'd some operators, but haven't made the final choice yet on those. And then, again, this is the second round where they're looking to get the youth crisis center and the East response zone crisis center up and running, or operators ID'd and stuff. So this might be the time where we start to hear from operators about letters of support and from the local jurisdictions. And then the operators put in a letter of intent for the RFP. Let's see. So the interesting thing about these facilities is that any patient that's in crisis or perceived crisis can go anywhere initially. So it doesn't necessarily have to be the facility and the jurisdiction where they live. But then they may be referred locally, back to that. So, and they can even go to critical care centers outside of the county, their own county initially if needed. So, there will be any single operator can't have more than 3 facilities. So no monopolies on this. And so in the stage of the capital development, they went into a lot of detail about whether they have a site or a tentative site or no confirmed site, how they work through that. And that was one of the things that the King County was saying, is that they would help provide staff or personnel to help with doing property searches and stuff like that. So city staff wasn't being tied up doing those kinds of research and such. So but they do prefer proposals from so they're going to be excuse me, let me back up here. They want the clinical components of either a single facility for the critical care center, or at least, or geographically adjacent facilities, or that they will be providing transport between the tiers of the behavioral health facilities. So and DCHS prefers proposals with co-locations of complementary services. We did talk a little bit about some of the problems with even the private ambulance transports, where it's all about sometimes the insurance and reimbursement. So Department of Health is currently working with state and the legislature on this going forward on payment policies to provide private ambulance transport. Because right now they provide within this the crisis care facilities, or for the patient, or from a facility to their home, but not to the the crisis care facility. Doesn't make any sense, but that's the way it is currently. So that's why they're working with the states, because they want to be able to get the private ambulance reimbursed, so they don't have to transport to the ER. That's where one of the loopholes is right now. Of why they're, at least for private ambulance, why they're going to the ERs first. So the roles of the jurisdiction are that letters of support are required. It's suggested if there is a no site proposal, but if they have ID'd a site, then it is required that they get a letter of support from the jurisdiction that they're proposing to move into. Let's see, the crisis care centers can be across, multiple jurisdictions, but they want to try and keep things within the centralized region that they're in. Jurisdictions can provide letters of support to multiple operators that are interested within their jurisdiction. So it doesn't have to be pick one and go on, but you can do more than that. And then for the letters of support, there's actually a website was provided that has a template for potential for using that as, so we didn't have to, if that ended up being something we pursued, that we didn't have to start from scratch on that. And I think that basically, so it looks like by June that there should be the kind of the next round going forward. And so again, this is going to be kind of a staggered approach, at least till 2030. And then they hope to have this all 5 up and running by then.
So I've got a couple questions. One is geographically, you spoke about the east zone. Do we know what it consists of? Is that, I presume it's Issaquah, but also Bellevue as well, or not that far?
I believe it is. But they had the maps. I just didn't get a chance to, download any of that to print up. But again, we can go to that on SCA and pull up that information. But the quick look I did of our zone definitely was like up to the pass,
Mhm.
and it did include Issaquah, and I thought it kind of did go into Bellevue, but obviously not Kirkland because Kirkland's in the north zone.
And then the other question is, does metro or public transportation play into the siting as well, the frequency of bus? Because obviously one point of entry would be an emergency room, but
Right.
that's not the only point of entry. It
Right.
could be somebody just going to the clinic,
That's what they're
right? It's a
saying.
low kind of barrier sort of thing.
Yeah, it's a walk-in.
Um, so will that have some play in the decision of where to put these?
It would make sense, certainly, but it wasn't listed in the kind of the overview that they did.
So once a person is released after, I don't know, 28 days or their whatever their stay is, how do they get back home? I mean, I guess it's by private, they have to call a cab, a Uber.
That's something though that private ambulance can do if that's needed, if there's other medical issues going on. That is covered currently for a patient to go from a facility to home. But yes, you're right, it can be from, but like you said, by bus, by private transportation. It's the same way, I guess, however, and part of that goal of the centers is that they will actually help with those types of resources for the patients. So they can get to their follow-up appointments so that they can, do the things that they need to do. They can also, they'll be able to help with if they have like housing needs, and have those kinds of, be able to refer for those kinds of resources.
And then as far as the siting go, do they have a preference of putting this on? For instance, the first one in Kirkland, I believe, is kind of embedded within, I believe, Evergreen, but I could be wrong. I could be
Close
Are-
by.
Are they trying to locate these by a hospital where it's not necessarily?
Necessarily. I mean, it's preferred to be, like they said, maybe geographically adjacent to different, it would make sense to be able to have all these facilities in close geographical proximity.
Mhm.
But it's not necessarily stipulated, and of course they'll be making the final determination on the sites and they did say that there was an extensive list of the review panel, what they look at. They didn't present that as part of it, but there is representatives from every response zone on the review panel, and they have a very varied kind of background from being in HR or other things within a municipality or service or things like that. So, And the other thing I was going to bring up is, DCHS will support the jurisdictions, as I mentioned, the funding. And that potentially can be, because one of the big things that has to be, part of this is with the jurisdictions is, um, they kept stressing the importance of community involvement in the decision-making. So that was a big thing. But they would help with funding for things like feasibility studies, the community engagement, property searches, and then, of course, the ongoing operations.
Okay. I've asked more than ample questions. Councilmember Christensen.
I appreciate the update. I've listened to a number of the briefings as well, so I don't have any additional questions at this time. My concerns were primarily around transportation. It sounds like it's still a work in progress.
Yeah.
Just making sure that one, folks can get there, and two, once their stay is completed, that they have a safe way to get home again.
Right.
As well as the wraparound services is really important because you got to set folks up for success, right?
And that might be something we could reach out to the Kirkland facility and see what it is they have in place, for, what they're finding works and doesn't work, since they're up and running now. And that was the one, as I had sent you the information before, that's the first responders were totally impressed and happy with the response that they've been getting with bringing patients into that particular facility. So
I think with Kirkland, they have kind of the ecosystem that is more conducive. It just makes me a little concerned. Definitely we need these. They'll probably reach a portion of whom needs it. But yeah, making sure that they're accessible and where they're not isolated from, the support system as well, I think
Right.
is really important. Yeah.
So what their suggestion was is if a jurisdiction is interested in having one of these facilities in their city or area, that they can certainly reach out. But I think otherwise, then it would be that if the operators were interested in coming to a particular area, they would contact the local jurisdiction for the letters of support and stuff. And so I didn't bring it up, but I am kind of interested, especially as we have, a juvenile facility here, if there was going to be some kind of integration with that. I realize it's on a separate level, but, there's a lot, there are things I'm sure the operators look at, but, that we don't even think about, so.
Excellent. Any other comments?
No, not at this time.
Attorney Burke, do you have any input,
No, I'm good. Thank you.
insight? Okay. All right. Well, thank you very much for sharing with us. We'll be back to consider it again at some point.
Yeah.
Obviously, hopefully sooner than later.
Yeah.
Okay, with that, we have come down to the end of the agenda. Either chiefs, do you have anything else that you'd like to bring up for the good of the order this evening? Okay, with that, good evening. City Administrator Chambliss. Is there a motion to adjourn?
So moved.
Second.
It's been moved and seconded, 5:34 PM. No objection. We stand adjourned. Thank you very much.